Well, hello, everyone. Welcome to another amazing installment of Wellness Talks. Look, I have been really diligent about planning out these Wellness Talk sessions, and my goal is to be able to offer a Wellness Talk session every single week right here on our YouTube channel. Eventually, we will share to other platforms, but I'm one of those kind of people. Let me master one platform first, and then we can move to other streams. So, again, welcome to Wellness Talks. It is our goal with Wellness Talks to offer strategies, innovative ideas, concepts, solutions to support you, the entrepreneur, on your wellness journey. And if you have tuned in to the Marketplace Pastors podcast, you know I've had some of these amazing wellness practitioners on the Marketplace Pastors podcast. And we just decided, you know what, instead of merging the health with more of the marketplace strategy side, let's create a whole nother lane specifically for health and wellness. And so this week, I have the amazing pleasure of sitting down with Dr. Gabrielle Williams. Dr. Williams is a Haitian-American board certified family medicine physician. She's a wife and a mother of two. She's also the visionary behind Gateway Direct Health. And together, we're going to explore this new paradigm of care for entrepreneurs and the underinsured, one that's built on relationship, prevention, and faith-based stewardship of our health, because our bodies are the temple of the Holy Spirit. And a lot of times when we read the Word of God, we hear about the temple, we hear about the tabernacle, but we are the living epistles. And as stewards of our body, we can better serve our communities, our families, and everything that we set our hands to do in the marketplace. So today we're going to discuss why, relying on urgent care isn't a sustainable for wellness. We're going to unpack how direct primary care empowers business owners and families. We're going to unpack practical ways to build a lasting relationship with your physician. We're also going to unpack faith-filled wisdom on caring for the temple that God has entrusted into you. So it's really important that you play close attention. Please share this with every entrepreneur in your network that you know that is either uninsured, underinsured, but really looking for a way to maintain their health and wellness in the wake of everything that's happening in our nation right now. There's so much uncertainty. And the one thing we cannot do is be caught off guard. So, without further ado, I'd like to welcome Dr. Gabrielle Williams to the stage. Dr. Williams completed her medical training at Emory University, and she refined her clinical expertise at the renowned Grady Memorial Hospital in Atlanta. She is also, again, the visionary founder of Gateway Direct Health, a membership-based medical practice dedicated to restoring the sacred trust between doctor and patient. And her mission is simple but powerful: to make healthcare timely, accessible, and hassle-free while building relationships that focus on prevention, education, and advocacy. And y'all know those three words are very near and dear to my heart: prevention, education, and advocacy. Dr. Williams believes in relationship-based care, and she believes in crafting personalized treatment plans that honor each patient's unique goals. Her work is driven by compassion, excellence, and a passion for helping families achieve true wellness, not just the absence of disease, right? And a lot of times when we think of going to a doctor or seeing a doctor, we're thinking about disease. But I'm the kind of person that is always wondering about well care. How can I stay healthy, right? And so I want to welcome again to this conversation Dr. Gabrielle Williams, and I want to say welcome to Wellness Talks. I am so happy again to be able to have these amazing conversations with you. The last time we were together was last year on the Women in Medicine panel that we did with the Atlanta Black Chambers Health and Wellness Committee. So again, we're full circle having this conversation again about health, about wellness, and how entrepreneurs can make sure that they're taking care of their bodies from the inside out. So tell us about your journey into medicine and what inspired you to start Gateway Direct Health.
Well, first, thank you so much. It's great to see you, Try. I mean, it's been a minute, but I'm glad that we're able to collaborate again. As I know about you, you are all for wellness and prevention, and like you said, not just the absence of disease, but whole person care. So thank you again for for letting me speak. So I was inspired to go into medicine because of the show called House that was back in the early 2000s, right? I think it was right after American Idol or something like that. So that was my inspiration because he always figured things out, right? I like to problem solve. But I also thought of like accounting, love math. But I found medicine to be a way for me to use my analytical math, science skills to help people. But as we know in real life, you don't solve the case every time, right? There's no like magic. You go through the house window to find mold, and that's the reason why that person is sick, right? So yeah, that was a good shock, like to see how medicine truly is. Where truly we're trying our best to help people, but unfortunately, it is coming from a place of what's the emergent issue, and if they don't have an emergent issue, okay, it's fine. And we're not really taught a lot about nutrition, exercise physiology, what normal groans and pains of adulthood looks like instead of always disease. And so that that in addition to how the big healthcare organizations and health insurance have come in between the relationship between doctor and patient or client or member. You could see how it's broken the trust. People come into the office and say, "Well, your clinic had me wait. You made me wait 2 hours before I see you." I was like, "I did not. I did not schedule 25 people on my for me to see today. My job did, and thus, I have to see 25, even if it means a 2, 3 hour wait for you. And in order to help cut down on how long people have to wait, I have to cut down on how much I spend time with people because I know people don't want have an appointment for 4 p.m. and not get seen till 9 p.m. That doesn't make sense. But in order to achieve these goals, we have to cut down on relationship. We have to cut down on face-to-face time. We have to cut down on education. We have to cut down on advocacy. And I did not go into medicine for that. Like a very truncated visit with people. I went into medicine to help them. And through my practice, I've learned healing really starts like one of the starting points for healing is having a safe space where the person can tell you what is truly going on and you are actively listening, not they tell you what's going on and you're on the computer looking at a screen. And because then that will lead to people not telling you what's going on. And when people keep it inside, they don't seek care. If they don't seek care, they wait till an emergency. And when there's an emergency, unfortunately, the intervention at that time may not lead to reversal of disease. It may lead to we're just gonna manage it now. So I'm trying to rebuild that relationship and really focus on prevention and healthy lifestyle.
Hmm. That's so good. And I'm grateful that, you saw that there was a gap. You saw that there was a need to make some adjustments. And number one, you stepped out on faith to do something that you thought needed fixing. And rather than try to fix the system that you were in, you just stepped out on faith and began to build this what you call direct primary care model, which I feel is like simply amazing. So tell us a little bit about what direct primary care really means and how it's different from that traditional insurance-based model of care.
Yes, yes. So direct primary care has been going on for so long. It just wasn't called direct primary care. It's when your doctor knew you, your family members, your dog, where you were working, and they spent time with you and knew you. Now, when we switched to more insurance-based or insurance played a role in devaluing primary care, that's where we see that they have lower reimbursements for the doctors for the visits. So the doctors had to see more people. And because they have to see more people, they have less time. Because they have less time, all we have time to do is refer. And so then people thought, okay, primary care is just a referral mill. But direct primary care is going back to the old way where there was no, not that there was no, but there was minimal intervention in that patient-doctor relationship. And so with this model, members pay a monthly fee or annual fee, and they have a personal doctor. That means one doctor who knows them, not five different people they see at different times and have to explain their story over and over again. They have one physician who knows them, who takes care of them, who advocates for them, who educates them, and is available when they need it. So there's no, so there's quick access. So your appointments start on time. Hallelujah. Because we are not about wasting time. So appointments start on time. They are 30, 45 minutes long. Some doctors do 60 minutes, 2 hours because they know how much it takes to delve into the issues. But also they're available after that appointment. Sometimes if you have a question for your doctor afterwards, you can't reach them, but not with direct primary care. Direct primary care members get their doctor's phone number and can call and can email and can text directly to the physician and get their questions answered, minimizing how much they have to go on Google to get medical advice so they can get it from a medical professional. But also advocacy. So I know as entrepreneurs, and self-employed, it's really hard to get access to care. We sometimes get underinsured. We don't qualify for Medicaid, but then regular insurance is too high and cost prohibitive. And so, with direct primary care model, with this membership fee, it's much less than insurance, but also we'll look for low cost medications and labs on behalf of our members. Let's say someone needed an X-ray, we would be able to let them know the cost even before they go there, right? Very cost conscious. So there's no surprise bill. They know what they're going into, what they're going to pay. If they need a specialist, if we can find out what the self-pay price is with the specialist, we can look for GoodRx coupons and pharmacies that have low cost medications. So really, really big on advocacy so that we're helping people, not just you figure it out in this world of healthcare where you are ignored and you have to keep fighting for your care. In direct primary care, we don't want our members having to fight for care. You're fighting for health, you don't have to do that. We'll take care of it for you and help you on that journey.
That's so good. And I know that your practice is in Georgia. So do you currently have a system in place where you're able to service people outside of the state of Georgia, or is there a network of practices similar to yours? So if a person was in another state, they're able to find a direct care practice or providers network. Is
Yeah,
there anything
great
that exists?
question. Yes,
Mhm.
yes. So I am only licensed in Georgia. However, a website called DPC Frontier is where you can find direct primary care practices. We are in all 50 states now. So it was 1 in 10 family medicine physicians are doing direct primary care. So we are definitely growing like wildfire because we're saying the healthcare system is a dumpster fire. Let's get out. I mean, many people have tried to and are trying to change the system, and I appreciate them. But sometimes you have to step out and create something on your own and realize, oh, more people are coming on. They're like, oh, I like this model, and hopefully that it speaks clearly to our government, to these healthcare organizations that patient care is not, we care for you in word, but not in deed. Patient care needs to be in deed as well. You need to take care of people the way that you promise to take care of them. I also want to say something. November 1st is Direct Primary Care Day, so DPC Day. So we'll be sending out social media videos about for DPCs in Georgia, and you'll find if you look for hashtag DPC Day, other DPCs in the across the U.S.
Hey, that's good. I'm so grateful to know about that. And we'll make sure to put that link in the show notes as well. And we'll make sure to add that hashtag even to this episode, just so that more information is accessible to those that are outside of the Georgia network, if they're around the US and they're looking for this care model. So let's kind of transition into this whole breaking the sick care cycle. Because, as entrepreneurs, as, underinsured or uninsured individuals, when they get a cold, when they are having some type of symptom in their body that lasts beyond a week, the first thing they do is they go to urgent care. People have become so dependent on the urgent care, out of pocket model, whether they have insurance or not, versus the relationship-based primary care. And unfortunately, like you've already stated, many people only think of healthcare when something is wrong. And so, in your opinion, why is that mentality, that mindset, or that approach costing us more physically, emotionally, and financially?
Oh yeah, that's a great question. Multifactorial for sure. But the things I think about is as rich as the US is, there's still a health desert. Like there's still an issue with access to care, like you talked about, those who are self-employed, entrepreneurs, underinsured. We will, and because healthcare is expensive, we will minimize how much we pay for it, and try everything but seek care until we can't anymore, which is fine, right? Like there's a place for advocacy and like taking care of your own cold, right? We got honey, we got lemon, we got ginger, we got cayenne pepper, we got onion, we got garlic, food is medicine. I got you. But when you take into account how expensive healthcare is, not just in money, but in time and how long you have to spend in the ER and urgent care for care, when we take into account the number of primary care doctors that are not staying in medicine anymore, and so that also limits access. People are like, all right, what's a quick place that I can go to that's relatively okay in price? That's urgent care. But the urgent care was meant to take care of urgent issues. What we see people coming to their urgent care for are issues that's been going on for 3 months, for a year, medication refills. Why? Because they don't have access to a doctor that knows them, that can take care of them. The wait time to get to primary care office now is 6 months. There's no UTI that's gonna wait 6 months. If you wait for 6 months for UTI, by 2 weeks you'll be in the hospital for a really bad kidney infection, right? Like those things can't wait, but unfortunately, there are multiple reasons why there's a lack of access, so therefore people using urgent care. But also, I can put it into our fault as well as entrepreneurs. We got stuff to do. We got a business to run, and we need that thing to be profitable yesterday. And so we are going to grind and hustle until there is no more. Problem is when you wait too long, and you don't do early intervention, you're gonna have worse complications than if you came in when you should have addressed things first, right? So and then when we lead to more complications, then we end up in emergency rooms and we end up admitted to the hospital. And that's because we waited so long because we were so busy. So there's also a responsibility for us as people to prioritize our health and prioritize it like we do our business, saying, I have a meeting at 9, I'm going to exercise at 8 or at 7, and I'm going to do it for 20 minutes. I'm not asking you to do an hour, at Burn Boot Camp or Hot Works or any of those big gyms, like dedicating the time, scheduling the time. Again, not prioritizing it just in your mind, but actually in action. So putting on the schedule, all right, I know in 3 times a week, I'm going to exercise for 20 minutes. I know that if I'm at my desk, I'm going to do, stretching exercises while sitting down, right? Um, I know that at 10 o'clock, I got to stop everything and go to sleep. Stop everything, including putting my phone down and go to sleep. I know that I've been dealing with anxiety, so I'm going to go see a therapist. I'm going to talk with my friends, make time to spend with my friends and family. I'm going to, instead of skipping breakfast, I'm going to eat a yogurt that's really quick, right? So that can help sustain me, high protein Greek yogurt, and then eat my meal for lunch instead of skipping my meals. So so we have to take responsibility ourselves and taking care of, like you said, the temple the Lord has entrusted to us, as well as we got to work on the system, or again, to go outside the system that's burning.
Yeah, for sure. And I love that you highlighted that we have to take responsibility for our temples ourselves. This month, I had the pleasure of, having some downtime. I very rarely get an entire month where I just get to just focus on self-care. As an entrepreneur, to your point, we're constantly grinding. But you remember last year when I shared with you that pivot that I made to move from grind to grace, and learning to build my business around this grace model. And sometimes that looks like picking up consulting jobs or some extra revenue streams while I wait on opportunities maybe to come through for my business model. But the beauty of me being able to take this month to, I mean, usually October, I'm doing domestic violence advocacy work. I'm speaking, I'm planning a benefit concert. Like I pivot from one thing to the next. But this month, God just so beautifully blessed me to be able to just focus inward on my self-care, because the rest of the year and 2026 is going to be like this. Like I already know it. If He's given me a whole month to just focus and to get clear on some things, I know what's coming after this. And so, what I was able to do for the month of October was to participate at my gym, Lifetime Fitness, in the 30 Strong Fitness Challenge. And what I thought was very unique about this 30 Strong Fitness Challenge is that they gave us disciplines, or I guess we can, 8 daily habits to track for 30 days to see how we felt. So before you start, meet with the trainer, you do your weight check, your BMI, all of your numbers, all of that assessment. And then once it started, you had to complete a daily workout. You had to walk 8,000 steps a day. You had to take 15 minutes of recovery and self-care every day, 15 minutes in nature, 7+ hours of sleep, 30 grams of protein per meal, drink half your body weight in ounces of water, and abstain from alcohol for those of us that may drink, right? And I was like, this is going to be great. Like, first of all, I wanted to see if I could work out every day, right? Like, the biggest discipline for me was, how would I feel if I worked out every single day for 30 days straight? And what does that look like to walk 8,000 steps and to, embrace how nature feels, and to make sure that I'm drinking half my body, and to make sure that I'm sleeping, and all of these things, these habits. And in the app, you have to literally check the boxes as you complete these tasks. And so there was even an accountability, and then there's like these prizes every week, and then there's this big grand prize when you finish. So it was the most amazing thing. And the biggest takeaway, I'm still in it. It goes through like the first week of November. But the biggest takeaway so far is the daily habits and the daily disciplines that I've been able to make a priority, and then build my business structure around that. So my wellness became like my priority, just like my spiritual practice, my time in prayer, my time in Bible study, my time sitting with the Lord is one of my priorities. My wellness is my second priority. And then everything else kind of fits into that. And if it doesn't fit, it just doesn't get done, right? But I think taking ownership of our health, of our wellness, of our well-being just naturally began to draw everything that I needed to me, right? Because my soul was well, my mind was clear, right? And I'm like, man, this is the best gift I could have given myself this month, is to just take 30 days to draw inward and to become physically strong. So as a result of that, I feel physically strong, of course. I've lost weight, I've lowered my BMI, I've got more energy than I ever had before, right? And I'm building my business plan for 2026 now, so that by the time it gets here, I'm already rocking and rolling. There's no having to grind and hustle to make things happen. And so I think that is something that we really, really, really need to stress to our entrepreneurs who are grinding but not taking care of yourself. Because the one thing we don't want to happen is to be out here building $1 million, multi-million dollar business, billion-dollar, trillion-dollar business, and then you drop dead of a heart attack because you're not taking care of yourself. Like, that is something that has been really near and dear to my heart since COVID. When I made the pivot from, business consultant to wellness practitioner, which I never saw myself doing, it was a God move. But most of the people that I was supporting in my business consulting firm started getting sick, or they had family members that were getting sick. And as a result of either them getting sick or them having to take care of family members that were sick, their business started to suffer. And I saw this in real time. And I'm like, there is a connection here, right? And so I think it's really important, this building this relationship with a primary care physician, having this ongoing relationship with a primary care physician rather than relying on urgent care visits, because I think it shifts your perspective from sick care model to just being well. Like, what are my numbers? Most people don't even know what their numbers are. They have no clue. And by the time you go into the urgent care, you go to the emergency room, they're telling you your BP is like mine, 238 over 135 at one point. And they like, ma'am, are you all right? You walking around about to have a stroke. Like, what's going on with you? And I'm like, I am, like, because it's the silent killer, right? But guess where I found that out? At a business fair, and Emory Johns Creek just happened to be there. They had a vendor table, and the Holy Spirit was like, "Go get your blood pressure checked." And I was like, "Okay," and I went and sat down, had my blood pressure checked, and they're checking both arms, like, "We about to call an ambulance for you." And I'm like, "But I feel fine." They were like, ma'am, go to the emergency room, right? So they sent me to the emergency room. The emergency room checked me. Numbers are sky high. Immediately, they're administering BP meds to get my blood pressure to come down. And even though I didn't feel it, even though I was operating at that level, when my numbers started to come down, I felt it. I felt the headaches. I felt the dizziness. I felt all the symptoms that, because I was in this grind mode, I just stuffed down. I didn't feel it, right? But just think, if I wouldn't have had the mind to sit down to get that number checked and then to go and see about it, you know, I would be dead right now. But here's the other flip side of that. If I had a relationship with my primary care physician and I was doing well care visits, those are things we could have discovered together and built a wellness plan around that, right? And so I think it's really, really, really important what we're talking about today. How do you think entrepreneurs or those that are self-employed, how do you think they can, you know, benefit from having that consistent primary care plan, even without having that employer sponsored insurance benefit? I know you've kind of touched on it a little bit about what you do in your care model, but how do you think they could directly, benefit from this? Because we really want to drive this home and share with those that are uninsured, underinsured, self-employed, that you can't afford not to. Like, real talk, you can't afford not to.
I mean, you said it, and I appreciate you for sharing your story because that be the thing that grind my gears is not just, like our body's able to compensate very well. The Lord has designed it very well that at those high numbers, you might not feel anything, but when you come down, like you said, you felt it. And I've heard people say, "Oh, I have so much more energy now that my blood pressure's controlled. Oh, I didn't realize how tired I was." Yeah, because we just find a way to operate and compensate and move things around and just like, all right, I still got stuff to do. But also, yeah, but also like you talked about with urgent care and sick care, if we just focus on or wait for a disease, it could be too late. And I was just talking with another business owner, and we were discussing how important it is to get care as business owners because I've seen where business owners have lost their businesses, still alive, but now on disability. And so that shift from independence to dependence drove them to depression, drove them to anxiety, drove them to addiction, alcohol disorder. Like I've seen that side. And man, God knows. I'm trying to catch people early or at least get them before then, and I'll take care of them after, if we get to that point. And so I just, yeah. And we don't want to use like, promise you guys, like, this is not a fear tactic. This is just reality of what can happen. And so taking time to pause, right? And figure out what do I want out of this life? Because I know what we want is to make money, sure. To help people, I got you. But we also want to be there and we want to be well to do that. And so you have to find a primary care. I mean, like that's just, and that's just minimum. You have to find a primary care doctor. And you have to find one that is focused on healthy lifestyle because not everyone is. So, that's also a point. You have to go in with questions. Don't come in with, oh, I don't know why I'm here. Come in with questions. How can I maximize my health potential? What can I do now? This is where I'm at right now, and this is my goal. This is where I want to get there. Can you help me get there? Yes, will it take maybe you trying a couple doctors before you find the right one? Yes, but it is still worth it. The effort is still worth it. The same way we say in marketing, you gotta talk to get 100 no's before you get that one yes. That's literally what the gurus say. Sometimes we even have to do that outside of business and, like I said, healthcare. But you could, again, direct primary care frontier or DPC frontiers where you can find a physician. A lot of them do meet and greets beforehand, so that would be a way for you to do something, get to meet them for free, ask your questions to see if you guys can relate and vibe well. Gateway Direct Health, we are happy to help our entrepreneurs, our self-employed, but also for small businesses that don't offer health insurance because they're not required to, or it's just really expensive for them. We have a business healthcare solution as well that, again, is a fraction of the cost of health insurance, but you are basically telling your employees, I care about you, not just about the productivity that you bring to the company, but I also care about you as a whole. And here's a private doctor that you can see anytime you want. Who got
Sure.
benefits like that? Small business
Right.
owners can.
Yeah, for sure. I love that. And I love the fact that Gateway Direct Health model is affordable, right? And it's like affordable access, consistent access to high quality care, right? So, what kinds of services are typically included in a direct primary care membership?
Oh, yes, great question. So I'm bringing back primary care to how I was trained, and that means we do a lot. 80% of the concerns that come in the office we can handle. We don't always refer out unless we have to, but we are doing our best to keep things in-house. So we will do the workup. We will try the initial management. But not only that, the first appointment is a wellness assessment. So it's in depth, probably 45 minutes to an hour long, of figuring out what people's goals are, where they are, and how we're going to help them and what their concerns are. I remember in insurance-based care, I had to tell people I can only address two things, and that's it. Don't come at me with a third or fourth or fifth. But with a longer appointment and having time to delve in and do a workup, we can go into multiple issues if that's what they have. Our I know in marketing, you're not supposed to say you help everyone, but most of the people in our practice are professional or entrepreneurial Black women who are relatively healthy, but we find out later they have other issues that they need to work on that we're happy to help. Man, I saw somebody yesterday and we talked mostly about her family. Like that was most of the visit and how it was putting stress on her as a mother of adult children and seeing your children suffer. You try to give advice. It was eye-opening for me. I learned from her like the different stages of parenthood. But that was the focus for today, right? I'm not a therapist, but I am happy to actively listen and to help people with their concerns that are not just medical. We also do sexual health, right? I'm a big proponent, guys. Not just the US, but Atlanta is just a little wild. It's a wild, wild west out there. And it's important to protect yourself. And I'm gladly to go into that. There's PEP, there's PrEP, there's all kinds of things. So sexual health, women's health, I talked about that. And if you have procedures needed, so like lacerations, if you have a cut on your arm that requires stitches, I can do that. Not a lot of us have time to do that, but we were trained to do that. Same thing for skin tag removals. Something I could do. Pop assist, a zit or get the pus and all that things out. So we can do a lot of things. We draw labs in-house, so we don't have to send you to different lab companies. We can save you time and money and gas. So yeah, those are the things that we do at Gateway Direct Health.
Nice. And I know, with this whole person wellness approach, even you're able to even give referrals to mental health providers if someone needs one as well. And I know you also have someone that focuses on nutrition within your practice as well. So how do you incorporate, wellness beyond the prescriptions, right? Nutrition, stress, rest. I know we already talked about rest and mindset, but are there other practitioners within Gateway Direct Health that could also help them as well?
Yes, of course. So we partner with a nutritionist as well as an exercise physiologist. So different than a trainer, someone who studied, exercise and they are able to curtail an exercise plan based on the person. So if someone has arthritis and they need modified exercises, that's what the exercise physiologist can do. And recently we're partnering with a social worker to help people who need resources. So there are some people who require help at home who are going to a rehab facility, but the family doesn't have time to go around and look. The social worker will do that and find like go out on a Sunday evening or during the day to see how the facility looks, how they treat their people, and do that on their behalf. If they have other sources that they need to apply for Medicaid, she can help with that as well. So that is our way of not just looking again at the physical body, but also the mental health, like you talked about, and also financial and social with our social worker.
That's so good. And I'm glad that, those resources are available because to your point, sometimes the need is beyond the physical. It's stress and how to manage your stress because stress leads to sickness and disease, right? In the body. I know that that was what was going on with me. It wasn't necessarily related to nutrition for me. Well, it was kind of, sort of, but it was more stress that was affecting my heart, that was affecting my blood pressure. And of course, I didn't know that. I'm making all these changes to my diet, but my blood pressure was still high. But once I got rid of the stress, then I started seeing, wait a minute, okay, it was related to stress. And just as we kind of like tie this amazing episode in a bow, when we think about prevention, right, and early testing, how does prevention and early testing um, play a part in long-term health outcomes? I think a lot of times we've already kind of talked about how, people have symptoms and they go to the doctor. And even as they're building a relationship with you or one of the DPCs that they might find in the network, you know, are there any like prevention testing that you do or early testing that can be done? I know it's October, which is Breast Cancer Awareness Month. I know that's one thing that we can do in terms of breast health, but are there any other early testing that individuals can do to make sure that these long-term health outcomes are sustainable?
Yes, of course. So I want to highlight one big one that we don't think about, family history. Doing a thorough family history, speaking to your parents who may not tell you on their own, but asking them, hey, what are you going through or what ran in the family? Because that is a big part of prevention. Because if we have someone who's had, or a family that's had multiple breast cancers, all right, maybe we need to talk with a genetic specialist and figure out, is there a gene that runs in the family? Do we need to do preventative breast removal in order to prevent breast cancer? If there's an early family history of colon cancer, you got to get a colonoscopy. The children have to get a colonoscopy 10 years before the parent was diagnosed. Not a lot of people know that. So family history is a big part of prevention. But in addition to that, with our wellness assessment, we do blood work to screen for diabetes, cholesterol. And if you don't have it, great. How do we keep it that way? That's a big thing because people are like, well, I guess you didn't do anything for me because I don't have anything. No, we thank God. First of all, we thank God and ask him, right? Through wisdom, he'll tell us, how do we prevent that from happening, right? How do we prevent diabetes? How do we prevent high cholesterol and heart disease, right? There's a coronary calcium score that looks at the plaque buildup in your heart to see how high is it? Is there a lot of calcium buildup in there? What's your risk of having a heart attack before that happens, right? Some people may be interested in cancer marker testing, right? Where they do a whole bunch of they look at a whole bunch of markers and see if you're at increased risk and and ask you to make sure to get follow up for that. There are people who do whole body MRIs because they want to know and make sure that there's no mass growing. Sure, there's some controversy about that, but I think if you're trying to do something proactive, I mean, all power to you, and to find a doctor that's willing to talk with you through that. And in addition to, like you said, your mammograms, colonoscopies, prostate, my men, right? Starting to get your PSAs early in your 40s to especially because we have a lot of prostate cancer in Black men. So, but that also starts with having a consultation with a medical professional to know, hey, what are the things that I can do to prevent cancer, prevent disease, and like you said, how do I maintain that whole wellness care?
Yeah, that's so good. And I'm so grateful that, you're compassionate enough to even think through these things with, those that you care for, because we often talk about, our body being the temple of the Holy Spirit. And this is what it looks like in actual practice, y'all. This is it. Know your body, nurture it, partner with a physician, wellness practitioner, who can see you as more than just that diagnosis. And I love that you talked about family history. Even in my work as a practitioner and doula, I do preconception wellness plans. And we really do a deep dive into family history. Because when you're doing preconception planning, it's important to know about that family history, and being able to partner with another practitioner to say, hey, I recommend that you see, your primary care physician to like address some of these things before you start trying to conceive. It's important for me to know that I'm partnering with a physician that understands whole care wellness, right? Because sometimes I'm like, you talk to your doctor and they told you what? And did they tell you anything else? Did they give you a plan? They just sent you home? What? Even with my expecting mothers, when they talk about they have gestational diabetes that they didn't have before they got pregnant. Now all of a sudden they're gestational diabetes. And I'm saying, did they give you a plan? No, ma'am. What? And so I thank God for my training. And I thank God that I understand that there's something that we can do about it by let's change your diet while you're pregnant for sure, right? And let's be more mindful and aware of how active you are and things like that. But not all physicians are doing that. And that is what's scary to me, that people are being sent home with a diagnosis with no wellness protocol. And so, for our viewers, this is, something that I know is going to be well received in our professional community. I want to, give you an opportunity to invite our viewers to reach out to Gateway Direct Health if they are in the state of Georgia, for one, but then also I want you to just go ahead and drop, the things that you have coming up in November. We'll make sure to put those links in the show notes as well so that people can really take advantage of taking ownership of their health and well-being. We can't complain about a system when there are resources available to us, and we are presenting you today with resources so you have no more excuses. So share with our viewers today more information about Gateway Direct Health, how they can contact you, and what amazing things you have coming up in the month of November.
Of course. So you can contact us at gatewaydirecthealth.com/services. And there you can see the membership pricing. Promise you guys it's affordable. Also, we are on Instagram, LinkedIn, TikTok, Facebook, all the social medias at Dr. Not Miss, so dr.notms. We are also November 1st, in addition to DPC Day, I will be doing a health fair with the Henry County Chamber of Commerce that I'm sponsoring. So that's really exciting. I'm trying to target my small business owners because we're struggling out here. And I want to be able to help and spread that message. And if you guys, if this is something that you're interested in, please feel free to contact us. You can call us or text us at 404-941-1415. If you know a family member that needs this type of care, please go ahead and share our contact information. We are happy to help. We are always happy to serve, because there's a reason why the Lord had me go outside of our traditional system, because that means that there's more people to help and serve outside of that system. So yeah, so I'm so grateful, 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 grateful for you, Miss Chai, for allowing me to speak. God bless you in your ministry. God bless you in your time of rest, and may He fill you up in that time of going, because it's about to start. things about to start running. So, may he bless you with that too. And I'm so excited for your journey through health, like doing the 30-day challenge. I'm excited. If you could share with me what like all your tips, I would love to hear.
Absolutely. I got stuff, girl. I got stuff. The breakthroughs and the revelation that I've gotten during this time has been, woo. I'm talking when I say a game changer, I can't
Yes.
wait to share just all that I've learned about myself, all that I've learned about my health, the strategies that God gave me to really track this has been just tremendous. So I will be sharing some things personally with you, but I'll also be sharing some things publicly with community. So again, thank you for being a great sister friend. I'm definitely sending my daughters your way. I've been telling them, I said, you know what, I'm just going to do an episode with Dr. Williams and send it to them because they got that mother's ear thing, like, I hear you, mom, but I don't really hear you kind of thing going on. But thank you again for helping us to rethink health as partnership, not panic. And friends, we want you to remember that urgent care is for emergencies. But wellness is for an everyday commitment. So let's build relationships that sustain the body as we pursue purpose and we build these amazing businesses. Because again, what good is it to build these multi-million, billion-dollar businesses and then we can't live to enjoy it? So we want to make sure that you're taking care of yourself. Remember, wellness starts from the inside out, and we want you to be well. So have a blessed day. And thank you so much for joining another amazing episode of Wellness Talks. Thank you.